Hi there. This is Dr. John Whitcomb talking about news in nutrition, metabolical problems of processed food from the brilliant book by Robert Lustig, Metabolical. Insulin resistance. What causes insulin resistance? Well, insulin resistance is core to the whole problem of what we call diabetes. And what you see is an insulin level that's above 5, and that's usually correlated with a tummy that's bigger than 40 inches or 38 inches in men, 35 inches in women, but elevated blood pressure, kidney dysfunction, maybe a little bit of blood in the urine, low level of inflammation, and big fat cells. You're slightly overweight, you're metabolically overweight. Insulin resistance is incredibly complex, but in effect, it comes down to an insulin level greater than 5. Now let's just unpack that. If you look at the normal range of insulin in most hospitals now, the range is 2 to 28, something in that order. But I've been around long enough to know of time when it used to be 1.4 to 21. I've seen one hospital that had 2.2 to 49. And that's because hospitals take 1,000 patients insulin level and they just get rid of the bottom 5% and the top 5% and call the other range normal, what they see in their population. That's not healthy. Normal is less than 5. And curious things happen above 5. And we're not quite sure what drives the whole picture. In fact, it's incredibly debated, and there's lots of review articles about it. I think the most interesting stuff is going on microRNA that are non-coding, like MIR29A, that basically is a microRNA that induces beta cell proliferation and insulin resistance. Why that's secreted, we just don't know the whole story. But we do know there's things like simple as fructose. Fructose is a sugar that's found in nature in fruit, where it's 6% and comes with lots of fiber. And when it comes with lots of fiber, the rate at which it gets into your gut isn't very fast. But when you drink a sugared soda made from high fructose corn syrup, it floods into your sugar at the amount of way more fruit than you would ever eat on by yourself. And that flooding overwhelms the mitochondria of your liver, and the liver is so stressed out, the only thing it can do is make fat to get rid of the energy that's being forced into it. And that makes the liver cells get fat, and you get fatty liver. But it also makes your fat cells get bigger. And your fat cells sort of act like they have a certain number of insulin receptors on their surface. And as your fat cells get bigger, those insulin receptors get further apart, requiring a higher and higher level of insulin to stimulate them. That's how they're acting. And that's a simple model to use in your head. So losing weight is critical to reversing insulin resistance. What will work for me? Well, what I know is if I do a 5-day fast mimicking diet per Walter Longo, and eat 800 calories for 5 days and measure my insulin on day 5, my level is 2. That's because I've not been eating anything but green vegetables and nuts for 5 days. 800 calories a day. But my BMI is a little over 25, and on a good day, my insulin level is 7 or 8 when I'm not on the fast mimicking diet. Interesting, isn't it? And it's a struggle for me. My father died of diabetes, and we're all on that journey. So losing weight is what's key to fixing it. So however you can find a way to lose weight, start by saying, I'm going to compress my calories into 8 hours a day, and then compress your calories into 6 hours a day. And say, I have to get out and walk 2 miles every day. 5 miles is better. And I probably should do some weight-bearing and exercise, get some weights, or go to the gym. Dr. John Whitcomb, insulin resistance is a problem of metabolic food. Read Robert Lustig's book, he's brilliant.